Hello everybody, I am Bilge. Today we are going to talk about our presentation, which is pharmacy's role in a modern health continuum. With my friends Bahan İpek, Ceren Kızmaz, Hasan Arda Aksu, Yiğit Çınar Uçar and Yiğit Gedik. First of all, the majority of the governments have made it a consistent objective to create a healthcare system that places individuals at the center of their own care and make efficient use of all resources. Accomplishing this objective requires different well-being experts to work as a team with one another to meet the well-being needs of patients. In order for that to take place, governments need to collaborate with all of the major professionals organization in order to make the most efficient use of the system resources. Additionally, pharmacists need to be recognized as a professional who oversees drug therapy management. In addition, governments must establish regulations, funding, and the policies that acknowledge and support to professional competencies of all the health profession and facilitate team-based care. And progress has been made. There have been advancements in interprofessional initiatives, electronic health system, education and training, the testing of new care models and regulation. In addition, pharmacists who meet specific requirements can administer drugs by injection, order laboratory tests, and can be granted additional independent prescribing privileges. More is required for the system and patients to fully benefit despite legislative changes. Pharmacy education continues to evolve to better prepare pharmacists for their roles and responsibilities in an increasingly complex healthcare environment with advanced patient health needs. And another important factor is also the pharmacists themselves. They have to know their responsibilities very well. The value of the clinical decision that pharmacists make with each patient encounter clearly lies in the future of the pharmacy practice. And overall, the ability of pharmacists to improve patient care and reduce cost has been tested and proven many times. And that's all I can say for my part.
And hello everybody, I am Ceren, and I will talk about the part which is pharmacists, the experts in drug therapy management. And first of all, there is always a risk of drug therapy problems for people who take medication. And when ignored and untreated, these issues are a major cause of morbidity and mortality. And they also place a considerable financial burden on the healthcare system. And pharmacists are experts in managing medication therapy, and they offer drug treatment management services that are based on collaboration between the patient, the pharmacists, and the patient's medical team, such as their doctors or caregivers. And the objectives of these services are to help patients identify and address current or potential drug therapy issues, and to encourage the safe and effective use of pharmaceuticals, and to make it possible for patients to have successful, focused therapeutic outcomes. And there are some components of the medication management framework. Bahan, can you change the slides? First one is assessment, and each patient is evaluated by the pharmacist by observation, discussion, and evaluation of clinical indicators. To avoid and address medication-related issues, treatment alternatives are evaluated for suitability, effectiveness, and safety. And the second component is care plans. The patient and other members of the healthcare team are involved in the creation of the plan by the pharmacist. The care plan outlines objectives and procedures for achieving the patient's individual health goals through the most effective use of medication. And education regarding chronic diseases for patients and caregivers is one action, as is writing a prescription to maintain care, starting a new treatment, and implementing programs for disease prevention like immunization and lifestyle change. And additionally, medication support systems like compliance packaging and medication reminders are included in care plans. And finally, last component is monitoring compliance and evaluating effectiveness. Through routine follow-ups, the pharmacist keeps an eye on the patient's adherence to and response to pharmacological therapy. These enable to evaluation of development, support, and the early identification of negative consequences, drug overuse or abuse. And that is all I can say about my part.
Hello everyone, my name is Yiğit Gelik. Today I am going to present to you pharmacists should be a part of person-centered care. Let's get started. Pharmacists must be part of person-centered care. Key barriers must be overcome to shift from a mindset of getting the right drug to each patient to getting the right therapy right for each patient, and to reap the benefits of fully integrating a pharmacist into a person's health care team. Can you open the next slide, now? These barriers include the following governance models, information management systems, and funding. First of all, I want to talk about governance models. According to reports, persons with chronic disease occupy 70% of hospital beds. Pharmacists are frequently requested to work with other healthcare providers, and many of them already do. However, there hasn't been much involvement of pharmacists in healthcare delivery governance frameworks. Similarly, community pharmacists need to participate more in primary care teams at the local level. Secondly, I want to mention about information management systems. It is necessary to develop information management systems that enable medication treatments, management, and drug distribution. The absence of such systems hinders workflow, informed decision-making, and care coordination, which results in subpar treatments and higher costs. And lastly, I want to talk about funding. To create an economic model for pharmacy that supports the actions and results that the healthcare system requires and funds. Funding organization and pharmacists must collaborate as the emphasis switches from medication dispensing related incentives to remuneration for drug treatments, management in diverse contexts and models of care. The proper balance must be struck. The tenets of patient-centered, team-based care must be addressed, and pharmacists and other health professionals must be integrated throughout a viable health system. Overall, money should follow the patient rather than the provider to maximize treatments through financial and other incentives. That's all. Thanks for listening to me.
Hello everyone, my name is Arda. From now on, I'll be talking about pharmacists' unique position as healthcare professional. Numerous patients engage with the healthcare system on multiple occasions. However, the medical practitioners who have the greatest potential for successfully coordinating medication are pharmacists. Community-based pharmacists in particular are easily accessible and in a unique position to promote the continuum of primary care. Among the members of a patient's healthcare team, who is the most accessible to reach is their pharmacist. It is possible to ensure that the patient receives the necessary therapies with better coordination of this accessibility. Better monitoring and coordination also lead to better care, less duplication of services, fewer emergency room visits, fewer hospital admissions, less medication addiction, and a lower likelihood of drug therapy issues. It is estimated that 12% of emergency department visits are due to drug-related adverse events. In addition, the probability of admission to a hospital is significantly higher among patients who had a drug-related visit. The healthcare team member with the most knowledge about drug therapies is a pharmacist, and they are equipped to apply that expertise and serve as the main coordinator of drug therapies. As a result, changes in condition can be identified earlier, including situations in which patients could benefit from better adherence to their treatment regimen. If quickly identified and discussed with the medical staff, this can be quite helpful. That's all for me.
Hello, everybody. My name is Yiğit. Now I'm going to present my part. Some progress has been made in enabling pharmacists to better contribute to patients' care, but more is needed to optimize the potential for these chains. And now I want to give five of them as an example. First one is, Bahan, could you go on? Okay. First one is government's responsibility. Governments should recognize pharmacists as the leading experts in drug management within the healthcare system. Bahan, could you skip? Yeah. Secondly, I would like to talk about the position of pharmacists in the drug therapy process. Health systems need to recognize the critical role of pharmacists as key coordinators of drug therapy management and facilitate seamless care delivery in variety of settings and models. Also, pharmacists should be involved in the management and delivery of team-based interdisciplinary models of care too. And after of that, health systems use integrated information management systems to enable pharmacists to coordinate and manage their medication and work collaboratively with other healthcare professionals. And finally, Bahan, could you go on? Okay. And finally, a balanced funding model be developed for pharmacy services to support coordinated person-focused care by aligning clinical practices with desired patient and health system outcomes. That's all I would like to say. Thank you.
Now it's my part, and I'm going to explain the conclusion part. The majority of nations' current healthcare systems are not designed to maximize the actions of all health professionals and are becoming more expensive without corresponding improvements in quality or accessibility. There have been many suggestions about how to fix these flaws, and we propose that government initiatives of person-centered care, continued care, mental health, and chronic illness management will gain significantly more traction if steps are taken to better incorporate pharmacists into the healthcare system. Accelerating the creation of creative team-based care models, improving the coordination of drug therapy management across the health system, and identifying and promoting opportunities for community-based pharmacists to access the health system will all contribute to improvements in access and quality. Better medication therapy coordination will reduce the redundancy and improve patient outcomes, and lowering system level costs and enhancing sustainability. And this is our references that we get from websites. And thanks for listening to us.